to start. Okay, airway. So we were saying airway, breathing, circulation, and airway and breathing usually are together. And we won't get into CPR, and we won't get into airway and the new protocols that are coming pretty soon. But we're going to talk about how to manage an airway. And first of all, there's kind of two main categories. There's, we could say, without use of any device, and device use. And the device use gets separated in two other categories. But basically, use of non-device is basically you don't have anything with you and you're managing the airway for that. On the other one, you need to use something to maintain the airway. The advantage of using a device versus non-device is that if you're using, if you don't use a device, then basically you have to maintain the airway all the time. So that means one person or yourself or whatever is stuck to the airway. So the advantage is that when you're capable, you put a device in, because that way you can maintain that person airway open without you being there, and then it gives you a chance to be able to continue either your exam, continue other treatments, or even to start thinking about how to get this person out, or build a shelter because the weather is coming in, or anything else. But that way this person again can breathe on her own, and it gives you the chance to do other stuff. So we're going to see both techniques, and when you use device, there's kind of basic, well, in the medical term, there's called BLS and ALS. So BLS stands for Basic Life Support, and ALS stands for Advanced Life Support. Advanced Life Support is paramedic, doctors, nurses. BLS is EMT, intermediate, there's different levels. First responders are in the BLS. So they'll use some device, but it's not, they're not, they require less training, and they require training and practice, but they require less training, and they're blind well, for example, intubation, there'll be blind intubation in a way, so that it's not fewer intubation, so you're not in the endotracheal tube, so you're not in the trachea, but you're protecting somehow the airway. Okay, so with my little friend Han here, I'm going to show you two major techniques on how to clear airway. Well, actually three, but she's missing a few pieces to kind of show you the whole technique. But the one I prefer is the first one I'm going to show you up, and it's called the jaw thrust. I prefer it from the chin lift, and I'll show you why. So the jaw thrust is basically you take the jaw, so you have your two hands over here, and put your hands on the mandible, so basically the bone here just beside, just sideways of your nose, and then two fingers kind of on the side of it here. And I don't know if you'll be able to see it correctly on the camera, but just pay attention to the chin over here. What's going to happen? It's going to lift. So you see, chin's lift. So if I put my finger here, see if, it's going to be hard to see, but yeah, so the chin's lift, and basically it's not so much you're lifting with those fingers, and you're kind of almost pushing down with those ones. The reason I like this one, and you can kind of see it on here on the side there, is that if there's a spine injuries, and I presume that most people that will need that in the wilderness will be related to trauma. You want to protect their spine, and by lifting like this, you're not moving the neck like this one here. So by lifting over here, I clear their airway, and it's very efficient. Like I do it quite often in the hospital, sometime when people comes before we start putting things in their mouth and things like that. Yeah, so you clear the airway just like this, and then you maintain. So as you can see over here, is that you have to be comfortable, and your elbow are down, and you hold. But like I was saying before, the problem with this is that now I'm holding, so I'm stuck here. So if I release it, there's no more airway clearance. So if I open it up like this, airway is open, airway is not open. So I have to stay here. So if I have to make a shelter or something, there's nothing I can do here right now because I'm stuck over here. The other advantage here of being here is that basically now I'm maintaining C-spine as well. So what we call C-spine, so cervical spine. So the cervical spine is over here. So if the person has some suspecting neck injury, by lifting like this, I'm preventing. The ones that most people have been taught or anything, it's a different kind. It's called, so this one was the jaw thrust. So the jaw, you're lifting the jaw. This one is a chin lift. And basically what the chin lift is, you basically put fingers behind the chin and you lift. As you can see here, as the chin lifts, the neck moves as well. And so you clear the spine, you clear the airway, but you're moving the spine here. So that's why I like the other one a little bit better. This one, the same thing, I have to stay over here. One advantage also of this one is that now I have at least a hand free, because this one I can maintain the chin just with my hand over here. So push the chin, and I can maintain the spine, the airway with my hands over here. But again, I don't like that one because of the risk of spinal injury. And the third one I was talking about is basically how you can position this person. And there's different names for them, but mostly known as the recovery position. And basically the recovery position is that what you do is you turn the person on their side like this. And how they're going to end up looking like is they're going to end up having a leg. They're going to end up having a leg here that's going to hold their body so the body doesn't do this. And they're going to end up having their head on their arm, and the other arm over here to prevent again that collapse over here. And then chin lift, hold it separately. The advantage of this is that now it doesn't need me. You can maintain the person like this, so you could go and attend and practice, start doing your shelter or whatever else you have to do. You could continue your exam, prepare for the extraction of the person or whatever. And then the airway is maintained. If they vomit, it doesn't go back into their lungs, because they'll vomit here. And yeah, so that's one advantage of that one. Again, that one has a little bit of the problem is that if your back, as you can see, my back is not straight. So like if I follow my back, you see it kind of goes sideways a little bit. So if I suspect back injuries, it's not a good position to put anyone in it. There's another one that is a little bit more, and I'll put a link down here explaining, but basically you turn the person with their back straight. So their back looks a little bit more like this, and the legs are more. So when we want to protect the back, it's basically from here to the neck here. So this is the part that you want to have in a straight line. So this is the another position, but I'll put a link on the down the video to show a little bit better how it goes.